And welcome, everybody, to another episode of The Mark Bishop Show. You know, one in every 110 babies in the U.S. is born with heart disease. Now, the birth of a child is a joyous occasion for an entire family, but for the families of the more than 40,000 American babies born each year with congenital heart disease, CHD, it can also bring fear and uncertainty. There are multiple types of congenital heart disease, and for families affected by a CHD diagnosis, they may not be fully aware of the various treatments and innovations in pediatric cardiac care. So, it's important that we know more, and to know more, my very special guest is Dr. Mathew Elias, an attending pediatric cardiologist in the Cardiac Center at the Children's Hospital of Philadelphia, affectionately known as C.H.O.P. Welcome, Doctor.
Well, thank you very much for having me. It's great to be here.
Yes, advances in prenatal diagnosis and imaging, it's allowed for early treatment for babies, apparently, with birth defects, like congenital heart disease. Can you elaborate a little more on that?
Absolutely. And importantly, as you mentioned, congenital heart disease, children who are born with heart disease, occurs so much more often than many realize. It's the most common birth defect in the United States. And as you noted, the number, it occurs in 1 in every 110 babies. Now, fortunately, many of these diagnoses of congenital heart disease are now made before birth. So this will often occur during that routine anatomy ultrasounds that families will have around 20 weeks during pregnancy. And if there's an abnormality seen there, mothers and patients are typically then referred to a specialist who can then perform a fetal echocardiogram, a dedicated ultrasound of that fetus's heart, to then come up with a dedicated plan for that patient and family.
What about this 3D modeling I read about in virtual reality? They're improving treatment options for children with heart disease, is that right?
Virtual reality and what was the first part you mentioned?
3D modeling.
3D modeling, yes. So I think that's one of the most fascinating aspects, and I might be biased. I just think it's so interesting. We now have such advanced imaging techniques, 3D modeling, to improve our understanding of each child's individual heart condition. So we'll often talk about a specific different forms of congenital heart disease. And even though several different children might have the same heart condition, the children are all different. Their hearts are all different. And it's so important for us to understand through more advanced imaging techniques, including 3D models where we can look at the heart in all dimensions to understand what is that individual child's condition. And even with virtual reality, for those children who need open heart surgery, our surgeons can then essentially look at the heart, almost operate on that heart through different techniques before the surgery happens, and avoiding any surprises in that operating room, which is always
amazing. Absolutely amazing. Look, doctor, do we know why 1 in 110 babies, I mean, the odds are, they're not good, born in the U.S., making heart defects the most common birth defect?
Yes and no. We still have so much more to learn. There's some forms of congenital heart disease that we know are associated with genetic conditions, but many are sporadic, they're random, and there's not necessarily a clear identifiable risk factor in those patients. This is an area of active research, and I am optimistic and certain that our understanding will continue to improve over time.
So how are heart defects diagnosed? I know you touched on it before, but, they're diagnosed and then they've got to be treated, right?
Definitely. So sometimes there's the prenatal diagnosis, that diagnosis before birth, and that occurs fairly often, especially for those with complex heart disease, but it's not 100%. So babies born with heart disease is going to be a surprise for their medical team, their families, and so all babies should have a critical congenital heart disease screen, typically in the first few days of life, before going home from the hospital. And that is essentially just an oxygen level check to make sure that these numbers are within normal limits. But children who are older, whether it's babies or older children, might have different findings on their examination or history that might make them then present to care, whether that's an abnormal murmur or different symptoms, chest pain, palpitations, fainting, that lead to evaluation.
Right. So they're the symptoms then that could be signs of a heart problem in a child. But for moms listening right now, and fathers for that matter, there's good signs. There's lots of assistant devices, the ventricular artificial hearts, the prosthetic valve repair. I mean, it's not like, the old days, is it? I mean, I think it's 97%, isn't it, that children born with CHD today are expected to reach adulthood.
That's right. And I think that statistic is certainly fantastic. It was not that long ago that we did not have many treatment options, and conditions were often universally and sadly fatal, certain conditions, but the future is so bright. We now have many of the technology advances that you mentioned, but minimally invasive procedures such as cardiac catheterizations. They're becoming more common for certain heart defects, sometimes replacing open heart surgery.
Mm-hmm.
There's advancements in early diagnosis before birth, sometimes even interventions that can be done before birth, which is fascinating.
Mm-hmm.
There's advanced imaging techniques I mentioned, and you mentioned the one advancement technology called ventricular assist devices, or VADs, and these are mechanical pumps essentially that in certain situations for children who have decreased heart function primarily, they can help improve a child's quality of life as a bridge to, in severe cases, getting a heart transplant, sadly, or in more optimistic situations of recovering. And I think there needs to be some further research on this next topic, but when used appropriately, there's going to be a role for artificial intelligence, I think, in medicine and pediatric cardiology. But there have been so many advances. I think the future is still bright. I'm very optimistic for the future of our children.
That's good. That's good. And for folks listening, for parents listening to this, what can children do to improve their heart health?
Well, there are several ways in which children can improve their health, both in the short term and long term, for those with heart disease or those without heart disease, really for anyone. I always emphasize heart healthy diet, of course, avoiding high sugar, high saturated fats, and then plenty of fruits and vegetables. But for our children, trying to decrease screen time and encourage outdoor play. So the American Academy of Pediatrics recommends children over 6 years old have at least 60 minutes, 1 hour of exercise or activity every day. We want to encourage healthy weight, adequate sleep, and routine medical care, including routine cholesterol checks for every child between 9 and 11 years old. And for many reasons beyond heart health, avoiding drugs, alcohol, and tobacco, of course, but we also want to be wary of energy drinks, which are not recommended in our pediatric patients and our children.
Interesting. Yeah, well, there's one. Well, Dr. Elias, I mean, you see patients ranging from newborns right through to young adults with a wide variety of congenital and acquired heart conditions. The Cardiac Center at Children's Hospital of Philadelphia, the team performed something like 950 pediatric heart surgeries a year, including open heart and closed heart procedures and heart transplants. I mean, you guys are busy, right?
Oh, we're so busy. There are so many patients every day with congenital heart disease, and many in our area, and we help treat anyone across the world and anyone who can come on over. Our cardiac center is one of the highest volume pediatric cardiac centers in North America, and our team, as you mentioned, is one of the largest of its kind in the world. We, you mentioned, perform nearly 1,000 pediatric heart surgeries per year. The number keeps on going up, and we see over 40,000 outpatients at 15 locations in Pennsylvania and New Jersey near us. So we are large, and we're continuing to find ways to advance the field.
Well, pretty fabulous. Absolute effort C.H.O.P is famous for. And for Children's Hospital of Philadelphia, you're the medical director of Pennsylvania Cardiology, satellite operations at Children's Hospital of Philadelphia, and medical director of C.H.O.P Cardiology in the Kawasaki Disease Program. You do a fabulous job. Now, visitors can go to the site. I think it's chop.edu/heart. Is that correct?
That's correct.
Okay. That's a good way to go. And there's a lot of stuff on there, very entertaining. When I say that, I mean a lot of interesting stuff to read. It'll keep you glued to the screen. And you can find out an awful lot more. If you think you've got a child with an issue, that's what I would recommend. chop.edu/heart. Well, keep it up, Dr. Elias. You do a marvelous job, and we're very grateful to you.
Well, thank you so much for the invitation to speak today. It's been my pleasure.
All right. Thank you. Good luck. Keep it going.
Thank you.